talk a little bit about plagiocephaly. I think the most important thing for parents to understand is why it happens. So if we go back and look at the data, about 30% of kids who lay on their back or back slept develop flattening. So it's not 100%. So the idea that back sleeping alone is the problem, the data wouldn't suggest that's the case. If that were true, 100% of the kids laying on their back would get flat. There's something different about the kids who get flat, and the underlying theme, and the reason they do, is because they have a risk factor for flattening. We can look at there's many risk factors that have been enumerated in the literature over the years, but if you distill them down, I did this in a paper in 2011 for Journal of Craniofacial Surgery, they come down to three major buckets. The first is congenital muscular torticollis, which is tightening of the neck muscle. That's from positioning in utero. Just like if I put your arm in a cast for a period of time, muscles get tight, one of the muscles gets a little loose, and you end up with this imbalance of muscles that takes a while to work out. And so if you think about a child being positioned in utero and developing congenital muscular torticollis, after they're born, they're going to tend to favor the position they were in utero. And you will find most parents, in fact I did a study on this as well, 92% of parents found, whose kids have flattening, found that their child had a favored head rotation preference, meaning that they went to one position consistently. You could try to rotate them, move them, reposition the room, whatever you did, they went back to the spot. And what we know is, of course, if you're laying in one spot over time and you're growing, the head is growing very quickly at that age, you can't go through the bed. So what happens is you get volume displacement. The head starts to grow around the bed, and that's what creates the flat spot. That's why, if you look at data, we will find that 6 to 8 weeks is when parents start to notice flattening. You may see a little bit at birth. There's studies on asymmetries that are present at birth, but what we find is actually there was a very good study that showed whatever asymmetry is present at birth is not necessarily correlated with asymmetry later in life. This is Van Glimmering, guy out of the Netherlands. And so the idea is that it's not that flattening at birth propagates into more flattening. It's that it really is irrelevant. What happens is this tendency to go to one position drives this progressive flattening over time. And of course, if a child can work the neck out very quickly, which is the goal of physical therapy, chiropractic, and other things, is try to work the neck out so that they short circuit that flattening process, and hopefully they now can grow normally and kind of dilute out whatever flattening is there. It doesn't mean that it will reverse therapy or resolving the torticollis will necessarily reverse established flattening, but as the head gets larger and growth occurs, of course, established flattening will look improved and will improve in real numbers as well. So torticollis is the big one. The other two are developmental delay and prematurity. And those, again, all come down to mobility issues. If a child is not moving as well and keeping their head in one spot, they're going to be prone to getting flat. It's very simple. Just like a pumpkin growing flat in a field, over time, if you leave the pumpkin on one side, it can't grow through the ground. It will grow along the ground, and it will develop a flat spot. You can go to the website and see examples of this. I've done this on the Noggin Doctor website, but this is the basic mechanism. So if we go forward and ask ourselves questions about plagiocephaly, let's go back over some of the myths. So the idea is, that repositioning, tummy time, and the like will obviate the need for any kind of other intervention, that this is the cure for plagiocephaly. Well, repositioning works great if your child is in the 70% of kids who are never going to get flat. It's very difficult for a child who has congenital muscular torticollis. So if you have a child with torticollis, you reposition, they go right back to the same spot, reposition, they go back. So unless you're willing as a parent to sit there day in, day out and continually readjust the head, they're going to develop flattening despite your best efforts. Tummy time is a way of trying to increase motor control, which, yes, that's helpful overall for all development, but it is not going to stop a child with congenital muscular torticollis from developing flattening. So that's number one. The second big myth is that it all gets better. So this is always thrown up by pediatricians. Oh, it'll resolve when they're sitting up, once they start moving and things like that. There are many people walking around with both plagiocephaly and brachycephaly. Plagiocephaly, studies on CT scans have shown that about 12% of people, adults and older kids, have a CVI of over 3.5%, which actually classifies them as having established plagiocephaly. So we know that it doesn't all go away. This is by CT scan. Those aren't even people with brachycephaly. So you can walk around and find lots of adult males and females who have flattening in the back. They don't have a lot of occipital curvature, and they have widening of the biparietal area. That's brachycephaly. That's about the same percentage, 12 to 15%. So, literally a quarter of the population has some head asymmetry as adults. So the idea that it all gets better is not true. What happens is, of course, established asymmetry looks less noticeable, stops progressing at about 4 to 5 months of age when the kids get moving, yes, but it doesn't all resolve and pop out. It doesn't go back to zero. For transcranial difference of 15, 16 millimeters is not going to go to zero naturally. But that 15, 16 millimeter difference will look less noticeable on a bigger head, and it will look less noticeable when the child grows hair, and it will look less noticeable when you're looking not from the top down, where it's very visible, but you're looking from a posterior or side view, like we do with see other adults. It looks it's like think about a helicopter sitting over top of the Empire State Building. If the Empire State Building, if you're looking at it from the helicopter straight down, you can't really tell how tall the building is. You're looking in the wrong plane. If you're looking at it from the side, of course, you have a very good appreciation of how tall the building is. So when you're looking at people's asymmetry from a posterior view, like we do other adults, you're looking at someone's head from the back, it's hard to tell what's going on there. But there are very good studies that say it's still out there. So the idea it all resolves isn't true. Does it look better with time? Absolutely. It will look better. The question is what's your tolerance as a parent for sitting there and watching it as a child grows. And some parents really don't want to sit there and look at their 2 and 3-year-old kid with established flattening, and people comment about it and the like. So that's where intervention comes in. And whether that intervention be a helmet, or whether it be something like the Perfect Noggin or the like, I think it is a parent's option, and certainly their right to want to intervene and do something to reverse a process that's acquired later in birth. The other big myth that I hear all the time is about containers. So yes, I don't think immobilizing a child in any container, whether it be a SNU bed or whether it be a stroller or crib or car seat or whatever for long periods of time is necessarily great. But in all of these devices, they may not be able to move their body, but their head is not restrained. So a child can move side to side. The idea that somehow they're going to hold themselves in a fixed position and develop this progressive flattening because the body's being restrained is not really true. And the data for containers being the big culprit really is pretty poor. There are some studies that suggest that use of car seats and strollers is so ubiquitous, it'd be very hard to do a study like that unless you completely remove those things from the control group and then had a group that continued to use them. That study's never been done. There's no randomized controlled trial like that. There's nothing that really suggests that's accurate. So these are 3 big myths. There's many, many more, and we'll go through some more of these down the road, but I just want to give you guys this information. Hopefully you'll find it interesting.